Gina is a pedicure specialist in a beauty clinic. Once she was attending a client. She noted that the lady had infected toenail with pus in it. She washed her hands but was worried that she might get infected. Following this, she began to wash her hands on a regular basis. Even after touching the equipments in the clinic that her colleagues were using, she used to wash her hands. She started to shower several times a day, and sometimes she could not attend the clinic for work, and she did not even leave the house because of the obsession. So she was taken to a psychiatrist for consultation. Gina was diagnosed with OCD, that is obsessive compulsive disorder. It is an anxiety disorder. It involves obsessions, that are unwanted thoughts, and compulsions, that is actions that is based on these obsessive thoughts. Types. Based on the nature of the symptoms experienced, OCD is divided into 5 main categories and numerous subtypes within each category. Contamination. Individuals with contamination OCD are preoccupied with fears of illness, germs, and dirt. As a response to such fears, they are involved in numerous compulsions in the hope of minimizing anxiety and cleansing themselves of any kind of contaminants. Ruminations. Here, an individual often experiences prolonged thinking about any question or theme, which leads to being mostly unproductive and undirected. Intrusive thoughts. Intrusive thoughts may be violent or disturbing in nature. The very idea of such thoughts can be horrifying to the individuals. Checking. Here, an individual's fear of harm, loss, or death is the obsession, and need to check is known as compulsion. Checking is often undertaken multiple times throughout the day and ends up being extremely time-consuming. Hoarding. Here, an individual is unable to throw away purposeless or worn-out possessions. They save or collect things even when they have no space to keep. Is known as hoarding. Symmetry and ordering. A compulsion to arrange your belongings or other items until they feel just right. A need for symmetry in action. That is, if you scratch your left hand, you also feel like scratching your right hand. Symptoms. OCD has 3 main elements. Obsessions, where an unwanted, intrusive, and often distressing thought, image, or urge repeatedly enters your mind. Almost everyone has unpleasant or unwanted thoughts at some point, such as thinking they may have forgotten to lock the door of the house. But if you have a persistent, unpleasant thought that dominates your thinking to the extent it interrupts other thoughts, then you may have an obsession. Emotions. The obsessions causes a feeling of intense emotions like anxiety or distress. Compulsions. Repetitive behavior that a person with OCD feels driven to perform as a result of the anxiety and the distress caused by the obsession. Compulsion starts as a way of trying to reduce or prevent the anxiety caused by the obsessive thought. Most people with OCD realize that such compulsive behavior is irrational and makes no logical sense, but they cannot stop acting on it and feel they need to do it. And not all the compulsive behaviors will be obvious to other people. Causes. The cause of obsessive compulsive disorder isn't fully understood. Main theories include biology. OCD may be a result of changes in your body's own natural chemistry or brain functions. If you have OCD, your brain has difficulty turning off or ignoring impulses from the circuit. This in turn causes repetitive behaviors called compulsion and uncontrollable thoughts called obsessions. Genetics. OCD may have a genetic component, but specific genes have yet to be identified. You are more likely to develop OCD if a family member has OCD. Learning. Obsessive fears and compulsive behaviors can be learned from watching family members or gradually learned over time. Diagnosis. Physical exam. This may be done to help rule out other problems such as alcohol, drugs, thyroid gland issues, and other health problems that could be causing your symptoms and to check for any related complications. Psychological evaluation. This includes discussing the person's thoughts, feelings, symptoms, and behavior patterns to determine if the person have obsessions or compulsive behavior that interfere with the person's quality of life, and may include talking to family or friends. Use of DSM-5 criteria. To receive an OCD diagnosis, one must meet these general criteria. That is, must have obsessions and compulsions, and these obsessions and compulsions must significantly impact the person's daily life. Management. Psychotherapy. Treatment for OCD includes cognitive behavioral therapy in the form of ERP, that is, exposure and response prevention, and medication management. The first step in any OCD treatment includes providing psychoeducation about the illness and the ERP process. ERP involves gradually exposing the person to a feared object or obsession such as dirt and letting them learn ways to resist the urge to do the compulsive rituals. ERP takes effort and practice, but person may enjoy a better quality of life once learn to manage the obsessions and compulsions. Medication. Certain psychiatric medications can help control the obsession and compulsions of OCD. Most commonly, antidepressants are tried first. Then, serotonin reuptake inhibitors with antipsychotics are tried. In treatment-resistant cases, other options may be offered. Deep brain stimulation. It involves implanting electrodes within certain areas of the brain. These electrodes produce electrical impulses that may help regulate the abnormal impulses. Then, transcranial magnetic stimulation. An electromagnetic coil is placed against the scalp near the forehead. The electromagnet delivers a magnetic pulse that stimulates the nerve cells in the brain, and it helps relieve the symptoms. Lifestyle and home remedies. Obsessive compulsive disorder is a chronic condition. It means that it may always be a part of your life. While OCD warrants treatment by a professional, but you can do something for yourself to build on your treatment plan. Practice what you learn. Work with your mental health professional to identify techniques and skills that help manage symptoms and practice this regularly. Take your medications as directed. Even if you are feeling well, resist any temptation to skip your medications. If you stop, OCD symptoms are likely to return. Pay attention to warning signs. You and your doctor may have identified issues that can trigger your OCD symptoms. Make a plan so that you know what to do if symptoms return. Contact your doctor or therapist if you notice any changes in symptoms or how you feel. Then check first before taking other medications. Contact the doctor who is treating you for OCD before you take medications prescribed by another doctor or before taking any over-the-counter medications or vitamins, herbal remedies or other supplements to avoid the possible interactions. Coping and support. It includes learning about the OCD, then stay focused on the goals, hobbies and recreational activities, practice relaxation and stress management techniques like yoga and meditation, stick with your regular activities. Hope you like this video. Please subscribe this channel for more videos on related topic. Thank you. Keep smiling.